Welcome to week 7 recording. In this week, I'll go through quiz 2 and I'll also go through what you should expect on ED puzzle and what's coming up in week 8. So let's start with the quiz. Question 1. Which of these is a type of CT contrast agent? Epidermal has to do with the skin, not a thing that we typically do in CT. Radiolucent contrast, not a thing. Intravenous contrast is the only option here. Question 2. It's possible for contrast agents to elicit allergic reactions. The obvious answer here is true. Question 3. Examples of digestive organs include, let's go through all the options. Liver, stomach, kidneys. Well, kidneys and bladder are a part of the urinary system. So that would rule out options A, C, and D. So the only answer here is B. Stomach, liver, and pancreas. Contents from the structure labeled 9 empties into the duodenum. So you would have to know that this is the stomach. We'll just look at that again really quickly. So you would have to know that that's the stomach. Let's find the abdomen. Make this larger. And you would have to know that this is the stomach right there. All right. That's the stomach, and that empties into the duodenum, the first part of the large intestine. The differentiation between acute and chronic conditions, both these terms are interchangeable, obviously not true. Chronic conditions are suddenly occurring, also not true. Acute conditions have signs and symptoms, whereas chronic conditions have neither, not true. Only option here is acute conditions are suddenly developed. Chronic conditions typically have been occurring over an extended period of time. Question 6. Select the image that shows IV contrast. All right, so the reason we give IV contrast as a reminder is to help us delineate structures that would look similar to other structures around it. So typically we inject or have the patient ingest contrast. We inject the contrast in the veins, or sometimes we insert it into the digestive tract retrograde. So here is the brain looking at the ventricles here and different lobes of the brain, frontal, parietal, and so on. And we're looking at, in option C, we can see the same brain, a different cut of the ventricles, and we can see the eyes, but everything looks the same in here, it looks homogeneous. Now we're looking at the abdomen, at the level of the kidneys. We can see the kidneys here, psoas muscle and the oblique muscles and the abdominis rectus. But we can't see anything as far as contrast because everything looks the same. So if there was contrast, it would either be ingested in the patient's intestines or injected, whereas then we could see it in the blood vessels, the aorta or the IVC, or in the kidneys. So the only one that has contrast here is this one, which shows contrast in the brain, in the circle of Willis. As a reminder, that's what the circle of Willis looks like in a 3D space. In CT, that's what it looks like. Question 7. An example of a major allergic reaction is, well, itching is not a major reaction. Neither is vomiting. Vomiting can occur. It's rare, but it's likely if the patient does not have an empty stomach, then they can vomit. But nausea is not an allergic reaction, it's a side effect. The respiratory arrest is the one that's a major allergic reaction. Question 8. Contrast agents for CT scans can be classified as negative, positive, or incandescent. Incandescent would mean this answer is false. Negative meaning it would not absorb the radiation, so it shows up as black, that'll be air. And positive meaning it has a high attenuation profile, which means it shows up as white, like barium or iodine. Depending on the patient acuity, how serious they are, it may be necessary to inject CT contrast such as iodine, barium, or air to delineate the blood vessels. The sentence is constructed properly, but the information is inaccurate because we never inject barium or air into blood vessels. So this is false. Question 10. Hounsfield units or Hounsfield numbers are significant to CT because, let's look at all the answers. These are only relevant to ultrasound. Well, we could clearly get rid of option A. Option C, these numbers are used to determine whether the scan was positioned accurately. No. CT numbers are eponymous and named after the scientist who discovered CT scan technology, Wilhelm Röntgen. Wilhelm Röntgen discovered X-rays. Option B is the only answer. Question 11. Scan planes routinely used in CT include all except, so if we look back on some typical images here, let me make this smaller. These are coronal planes, which are coronal images, which divide the body into anterior and posterior sections. These are sagittal images, which divide the body into left and right sections. And these are axial images, which divide the body into superior and inferior sections. So which is the one that's not used? Obtuse, not typically used or routinely used in CT. Sometimes a doctor might need to see an oblique image, depending on if they're trying to place a needle, but it's not a routine plane that we use. Question 12. Positive contrast agents used in CT are useful because of their high atomic number and high beam attenuation property. So those two correlate. If it has a high atomic number, it's dense, and hence it would absorb the radiation, have a high attenuation property. So yes, that's true. And if you got question 12 right or wrong, then you would get question 13 right or correspondingly wrong. Because this is the opposite. High attenuation, high atomic number, low beam attenuation property, those two do not correlate. So this would be false. Question 14. The black area on this image have this appearance because the black area here, let me see if I can make this larger. So these areas here have this appearance because the lung tissue is filled with air which has a low beam attenuation property, right? In the same way a negative contrast agent would show up as black because it has air. We use air for negative contrast, and air is in the lungs, hence it shows up as black. Question 15, select the axial image which shows the kidney. Again, as a reminder, axial imaging divides the body into superior and inferior sections. So we can see, let's skip to the others. We can see, let me make this large so you can see this one better. So this is option C. We can see all kinds of stuff here. We can see the aorta, the IVC, the psoas muscles. We can see the vertebra, oblique muscles, abdominis rectus. If you can guess what this abnormality is, what's the salient abnormality here? We'll come back to that in a second. Here we can see the liver, the portal vein, and the spleen. This is not the kidney, that's the stomach, the colon, small intestine. Something's wrong with this patient too. We can see the pelvis and the bladder, but no kidney inside here. And this one we can't see any kidney. That's actually the psoas muscle. And that's also muscle inside the pelvis, and that's intestines. This is the only one where the kidney is present. Those are the kidneys, those are blood vessels, that's the intestines, that's the liver over here on patient right, our left, or screen left. Question 16, the part labeled 1. Let me make this larger. So we're going to go through all of them. Let me make this larger. So part labeled 1. So 1 would be the lung. 2 would be the aorta. 1 would be the lung. 2 would be blood vessels in the liver, right? Typically, we're going to talk about what these blood vessels are in a second. 3 would also be the liver. 4 is a blood vessel in the liver. We'll talk about this in a second. 5 would be the stomach. 6 would be a part of the colon. Typically, we would call this specifically the left colic flexure. Number 7 would be the spleen. Number 8 would be the left lung base. Number 9 would be the aorta. All right, so these blood vessels are the hepatic vessels or hepatic veins, right? You could see them right in here. And so that's the left, and that's the right. So what's one easy option for your right lung? So if you're in the exam, the ART exam, doing for any content, and you practice, or let's say you're practicing for the exam, try to answer all the questions. So if it's a labeling question, try to label everything on here. It gives you good practice because it might pop up again somewhere. So this is a good way to practice. Doesn't matter what if you know the option and you're practicing, try to know what the other options are. This is a good way to practice. Number 8, I'll leave it. Number 17, I'll leave it magnified since this is also a labeling question. And we're going to go through all of them. They're asking for what is label 6. So I put label 6, which is here. We'll go through all of them. Option 1 is coming off of the IVC, which is not shown here, but the IVC will be right on it. And number 2 will be the top part of the right kidney. So if we were to scroll up, we'll be looking at kind of like this, right? And so we can see the IVC here. It's a little weird how it looks on this image, but this is coming off of the IVC. Number 3 is the aorta. Number 4 is the celiac trunk. Number 5 is the left kidney. So stop the right kidney. This is the left kidney. Number 6 is the colon. Number 7, well, it's kind of hard to know, but it's a splenic vein. Number 8 is the tail of the pancreas, and number 9 is the portal vein. The ones that you need to know on both of these images, at least at this stage, is this is the liver, that's the spleen, that's the intestine, that's the stomach, that's the aorta. If you know that, you're well ahead of the game. Same thing here, that's the kidney, you should know that's intestine, that's the pancreas, that's the liver. The blood vessels, I wouldn't worry about that right now. You should know that's intestines also. These are just abdominal muscles. All right, actually I could leave it magnified, I think. Let me leave it magnified, this might be good. The reason we inject oral contrast, such as barium, for CT scans, well, we never do. Oral contrast, such as barium, is never to be injected. Number 19, examples of negative contrast media used in CT scans. Well, we kind of alluded to this earlier. That'll be air. We do use barium, we do use iodine, we do use water-soluble contrast. Number 20, the term which means against natural flow would be retrograde. Mastication means chewing. Colonic regurgitation is a kind of a made-up term. We would call this GERD, gastroesophageal reflex, but I've never heard of colonic regurgitation. Maybe it's a thing, but I think I just mushed these two terms together. Peristalsis is a contraction and relaxation of tubular structures just to move things along, such as in your esophagus or your rest of your digestive tract, or something, and your urethra also. Number 21, the organ where bile is stored. Now, bile is created in the liver, stored in the gallbladder. Number 22, the main function of the pancreas is to secrete enzymes to break down sugar or to regulate blood sugar levels. Not produce urine, not to regulate temperature. Hence, all of these cannot be correct, so B is the only option. 23, when an organ or part of an organ protrudes through an opening, that'd be hernia. Fistula is an unnatural tract. GI hemorrhage is a thing. It's called a GI bleed, or blood vessel ruptures, or your internal bleeding. Interface GI loop, another thing. I think I mushed these together. 24, the first part of the small intestines, by now we should know this, the duodenum. The rest of these do not pertain to the small intestines. IVC just means inferior vena cava. We can see that here. Here, you can see it there. The inferior vena cava, by the way, returns blood from everywhere below the heart, right? And the superior vena cava, as the name suggests, would be above the heart. It returns blood to the heart from everything above the heart, right? 25, match these terms and definitions. Insulin regulates blood sugar levels. Bile emulsifies or breaks down fat. Accessory digestive organs play a role in digestion but do not have direct contact with food. Diverticulosis, small abnormal pouches in the colon. Osis, just a condition of having them. When they become inflamed, then it's called diverticulitis. A suffix there meaning inflammation. Mechanical bowel obstruction is a physical blockage of the intestines. Otherwise, we can have something where the nerves are impacted or the blood vessels are impacted. This is a mechanical obstruction, something's physically blocking it. And this is the end of what I think is a reasonable quiz. All right, so coming up in week 8, let me put this back down to size. In week 8, we'll be talking about the respiratory system. So you'll have 2 PowerPoints. One is voiced, one is one you just review. We'll just review what we talked about in the voiced lecture, and there'll be discussion entry 3, another graded item. There is also, for this week, week 7, an ED puzzle assignment. So when you log into ED puzzle, you will see the respiratory system. That's a primer for week 8. And that will be due on the 22nd, and it will open, I should be open by the time you're watching this video. All right, reach out to me if you have any questions. Take it easy.